Alrighty, everyone. Apologies for the slight delay. But I see we've got a good number of folks who are ready to go. So I will get us started here in just a minute once I get my slides together. Thanks for your patience. Let's see. Okay, so hopefully everyone should be seeing the slides now for the webinar. So again, thank you all for bearing with me with some technical difficulties plugging in. But I know folks are very interested and eager to learn about Medicaid. So yeah, we'll go ahead and jump into it. Please do let me know if there's any issues with the audio or anything, but we'll jump on in. So just to introduce myself quickly, my name is Jaeger Spratt. I am the Advocacy and Treatment Access Program Manager. So I'm here to talk to you today about what to know about the upcoming Medicaid changes. So I'll definitely open things up for a Q&A. After I get through the slides, I'm more than happy to have any questions come through on the chat. I believe there's maybe also a Q&A, yes, a Q&A area. So I'll try to refer to that kind of periodically throughout, but like I said, there's definitely going to be time for questions at the end. I did also thank you everyone who submitted questions in advance. I did put a couple of those community questions at the end, so I'll go over those, and then that'll kind of lead us very smoothly into the rest of the Q&A. So we will keep trucking along here. The So first off, just to put out a quick thank you to the sponsors of PHA Live series, Johnson & Johnson and Merck. We do appreciate their support of our program. And then very briefly, some housekeeping notes. Do want to give a quick plug for the professional membership at PHA. There's a bunch of really excellent benefits that come along with that, and that does really go a long way in helping us sustain our mission. So whether you're a healthcare provider or whether you are a patient or caregiver, there is free membership now for patients and caregivers that gives you a whole bunch of really wonderful resources. So there's something here for everyone, and all the membership information that we can gain is super helpful to keeping our programs going. So unless there are any issues, I think hopefully people are hearing this. Let me just double check that I can see the chat. Okay, perfect. People are confirming they can hear. Thank you so much. Appreciate that. All right, we will roll right along. So first off, just kind of a very bare bones basic level setting to make sure everyone understands what we're talking about. Medicaid is basically 50 different programs run by each state individually. They provide health insurance coverage for low-income individuals. So at the moment, the rough estimate is a bit over 71 million Americans are getting coverage through Medicaid. So this is particularly for folks who are disabled or elderly, minors, or are pregnant. The eligibility requirements do vary quite a bit. So there's a lot of states who are considered, quote, expansion, where the eligibility requirements are pretty much just to be low income. There are some states that are considered non-expansion. So to qualify for Medicaid in those states, you would have to meet that low income requirement plus the additional requirements. One really important thing that I do want to call out in that box on the left, not everyone realizes that they have insurance through Medicaid, which is because some Medicaid programs have different names and don't include Medicaid in the name at all. So I do just kind of want to do a quick PSA right out of the gate. Double check the name of your state's Medicaid program and just make sure that you know where your coverage is coming from. That is super important as we're entering this phase of a lot of changes. So we just don't want people to be caught unawares. So, what is kind of going on with these changes? Why is it happening? So, these particular changes I'm going to share with y'all today are coming from this large bill that was passed in 2025, which you might have heard called the One Big Beautiful Bill Act. Um, so that law is quite expansive. It has a lot of changes, including tax breaks, and of course, like we're talking about today, making some pretty large cuts to social safety net programs. There's a really nice summary that I found online, so I'm linking to that here on this page if people want to get into a little bit more of like the finer details of what this bill does. But I am going to walk us through today on kind of what changes are specifically the most relevant to the PH community. Um, so I will note these changes apply to folks who have Medicaid through that expanded coverage that I mentioned in the first slide. I'll explain a little bit more about what that means, but just to keep in mind that this isn't across the board for every single person who has Medicaid. So the first change is the implementation of work requirements. So basically, people who are enrolled through that Medicaid expansion have to show that they are spending 80 hours a month doing some combination of working, getting job training, being enrolled in some kind of educational program, volunteering, or doing unpaid caregiving work. There's also a lot of kind of exclusions and exemptions that I'll get into shortly. I did see there was a community question about kind of what about caregivers? So just to give a little bit more detail on that unpaid caregiving part. So caregivers in general do get somewhat of an exemption, but if you don't fall under the specific guidelines of what qualifies as a caregiver, unpaid caregiving work does still qualify. So for anybody who that might apply to, those hours spent doing caregiving can count towards that 80-hour total. And then the second thing that these Medicaid changes are bringing is an increase in the rate of eligibility renewal. So previously, everyone's Medicaid was sort of re-verified every 12 months. For people with expanded, who are getting coverage through Medicaid expansion, that'll be tightened up now to every 6 months. So just kind of increased rate of paperwork and those kinds of things. So, like I was talking about in terms of who these Medicaid changes apply to, it's basically low-income adults who are between the ages of 19 and 64 and are considered able-bodied. Unfortunately, that is how our government is describing it. Basically, anybody that the government considers able to work or who don't have a disabling condition, and also people who are not enrolled in or eligible for Medicare. Um, so hopefully that is clear, but I will pause if that's something that people, oops, that is not what I wanted to do. People want, have any questions on that? There we go, get my slides back. All right. Okay, I do see someone had asked if you can get the slideshow after the presentation. Absolutely, we will make sure that these slides are available to everyone. I believe they will likely also be up on PHA Classroom. So yeah, don't worry about trying to take notes on every single slide. That you'll definitely have access to this afterwards, as well as to all the links that I'm going to have scattered throughout. Okay, so moving right along. So first off, some of the exemptions from the Medicaid changes. There's 8 states who never, or I think that, certain number of states that never expanded Medicaid eligibility. So for those states, Alabama, Florida, Kansas, Mississippi, South Carolina, Tennessee, Texas, and Wyoming, none of these changes apply to you because your state did not expand Medicaid coverage. Um, I think, yeah, we'll leave it at that. There's a couple of states that are like in a little bit of a gray area, but basically those ones, yeah, this doesn't apply. So, next exemption from these Medicaid changes are people who meet that low income criteria and who also meet at least one additional eligibility criteria. They would be exempt. So, that includes kids, that includes adults with a disability, anybody who's over the age of 65, anybody who is pregnant or postpartum, and anybody who is receiving Social Security, or sorry, supplemental security income, so that SSI or SSDI benefits. Um, I do want to kind of call out, even for folks who do fit within this category of exemptions, just to keep in mind, it's possible you may end up needing to provide documentation to show that you should be exempt. So I will get more into that in a couple of slides, but just kind of keeping in mind that it is still really important for you to keep an eye on any kind of communications that you might get from your state's Medicaid program. So then this next set of exemptions are for people who do have Medicaid through expansion coverage, but have one of these other conditions or statuses that would mean they will also not have to follow the work requirements. Probably the one that's going to be most relevant for folks in the PH community is right up there on top. People who the government defines as medically frail or having complex health needs. That particular definition is actually currently up in the air, so I will go into more about that in the next slide. But the other exception that I think is probably going to be relevant for our community, it also extends to people who are caretakers of either children under the age of 13 or any caretakers of anybody with a disability. So I've got kind of additional details about that, but hopefully it's like a broad category that's pretty clear. So anybody who's the main caretaker for folks with disabilities would not have to fulfill the work requirements. So in terms of that medically frail exemption, basically, the Centers for Medicaid and Medicare Services released guidance about this new law earlier in June, which added some more narrow restrictions. So basically, it requires that people who get this exemption both have a medically complex condition and can show that it significantly impacts their ability to work. And now, because of that two-part definition, um, officials from about half of all of the states have filed a lawsuit at the end of June against CMS and against the Health and Human Services Department, basically challenging this rule, saying that it doesn't follow kind of the letter of the law of Congress's intention, that it's has a more narrow definition, and so it's asking that the court suspend this most recent guidance that was released in June and require that CMS not enforce that more narrow requirement. So sort of TBD on exactly how we're defining medically frail, but that exemption, of course, does still stand. We're just figuring out exactly how it's going to be defined. I know that is a little bit complex, to say the least, so I'll just take a quick peek at the questions. Okay, nothing about the medically frail exemption. So let me double check if there's anything in the Q&A. Okay, not yet. Great. So I'll keep us rolling along. So in terms of when you can expect these changes to start, January 1st of next year is the deadline for these implementations. However, Three states have chosen to start earlier than required. So Nebraska started all of this on May 1st. Montana started it just last week on July 1st. And Iowa will be starting it on December 1st. And then, sort of along those lines, Arkansas has soft launched these changes starting in July, but they're not actually enforcing it. They're not going to disenroll anyone until the beginning of January. And then in that kind of gray area that I mentioned, so Georgia has already had basically a waiver within the Medicaid program to put in place work requirements since 2023. So they've kind of already been doing it. They were a little bit of a testing ground for this. So folks in Georgia, this is less new than it is for everyone else. Okay, so in terms of how these changes are going to work, how this rollout will happen, states are required to send notice to folks. Some of those notices likely have already gone out. It sort of depends on the details of how the states are going to be implementing this, but basically everybody should be receiving the notice about this by October of this year or sooner. From what I understand, I think only people who these changes actually apply to, who are not exempt, are getting those notices. But in general, it's really important for everybody to keep an eye on their mail starting now until kind of basically forever. But definitely keep an eye out from your state about communication on these changes. So whenever your particular state is going to start implementing this, the first step is actually for those states to use existing data sources to check whether people are exempt or whether they are complying with the work requirements. So that first part, there's not actually any action that someone enrolled in Medicaid needs to take. This is all going to happen behind the scenes. And then, if needed, states will reach out to their Medicaid enrollees and request more information. So, this would be if they're not able to confirm if someone's supposed to be exempt or if someone is complying with the work requirement based on those data sources. So, if you get a request for more information from Medicaid, then you have 30 days to send in documents to prove whether either you should be exempt or that you have been meeting the work requirements. So that might be medical records, that might be doctor's notes or pay stubs or transcript if, or, volunteer hours, something like that. That would be kind of how that gets proven. In terms of that rollout, that's how things should work. Of course, we know that things don't always go as smoothly as planned. So for one thing, we definitely know that the Medicaid programs are going to need additional staff to comply with all of these new changes. So just kind of bear in mind that might mean longer wait times than usual. And that definitely opens the opportunities for additional administrative errors. So the thing I really want to emphasize with folks, it is possible that people could lose coverage even if they should be exempt for any number of kind of bureaucratic red tape reasons, whether someone misses that request for information or if they can't find the documentation that they have that would prove that they're exempt, or if for some reason they're struggling to submit the information correctly. All of that could lead to someone losing coverage even though they are eligible. So because of that, like I said, it's just really important to stay on top of communications with Medicaid. So if you do happen to lose coverage, so folks are dropped from Medicaid coverage after 30 days of that request for information. So if you haven't responded back to that request within 30 days, you lose coverage. After the 30 days, then there is a 90-day, basically 3-month grace period where you can submit that requested documentation and your Medicaid coverage would be reinstated and be like a little bit more quick. After that 90-day period, then you'd basically have to start a brand new application for Medicaid coverage in order to get back on if you do believe that you should still be eligible. So that is what happens if you lose coverage. How do you avoid that happening? So the main steps that we're recommending right now, make sure that all of your contact information, your home or your mailing address, your phone number, your email, keep that up to date with your state's Medicaid agency. Make sure that you are checking your mail regularly and your email. Just stay on top of any kind of communications that you're receiving from Medicaid. Make sure that you're responding promptly to that documentation if you do receive a request for it. And then also be sure just to update Medicaid about any kind of life changes, like changes to income or pregnancy status, ability to work, or if somebody is moving in or out of your home, that would like change your household income or, or number of people in the household type of thing. So in general, just making sure that Medicaid knows what's going on with you and that you are in touch with them. Okay, let me see here. Any questions from the group? Okay. So I see Nesha says she notices that most insurance with Medicare requires prior authorization every 6 months also. It's a great point. That is probably going to make things a little tricky, but I think in terms of, so this will only, like I said, will only apply to folks who have Medicaid coverage through the expansion group. So that, the 6 months prior auth is going to be connected more to like, obviously with people's prescriptions, whereas the re-verification of eligibility is like, do you still qualify for this insurance as a whole? So there might be some weird timing things with that. It's possible that people might like lose coverage at an awkward time. So that's, I think, something else to keep in mind. But yeah, that hopefully that answers that question. Okay, so that is kind of the gist of the changes that are going on. I know I went through that pretty quick, but hopefully it's clear. So I'll jump into some of those community questions that folks submitted, and then I can open it up to the audience here. So, first question, will the upcoming changes to Medicaid involve any issues with coverage of specialty medications or with supplemental oxygen or specialist visits? So there is so yeah, the answer is maybe. There's not any like specific part of the law that actually tells states not to cover certain services or prescriptions. So that level of detail is still up to each state's Medicaid program. However, this law does mean that states are receiving less federal funding for Medicaid. And so each state is going to be kind of determining what next year's prescription formulary and their covered services and all that looks like. So it is likely going to be a challenge for some states to find the funds to cover services at the same level, since this bill is reducing federal funding. So different states are taking different steps to make up the difference. We hope that a lot of states are going to find different ways, but it is possible that some of them might choose to shrink formulary lists or take other kinds of cost-saving measures. So again, more reason to get in touch with your Medicaid, your particular state's Medicaid program, and just make sure you pay really close attention to what's coming up in the next year. So the next question is, will copay assistance be affected by these Medicaid changes? So in terms of like nonprofit copay assistance, the answer would be no. That copay assistance should remain unchanged if you're getting that help through a nonprofit foundation. If you're getting assistance through something else, then like I know Medicaid has some like kind of no, I take that back. Scratch that. I'm thinking of a different thing for Medicare, not Medicaid. The one caveat that I will say though, in terms of Medicaid, so most nonprofit assistance programs do have a requirement that you have some form of insurance that will cover your prescription for you to be eligible for their assistance. So for anybody who does end up losing Medicaid coverage, They would either need to get back on Medicaid coverage if they are still eligible, or they would need to find a different source of coverage to keep receiving that assistance from the foundation. Okay, so then third question on this slide, how can seasonal workers meet the 80-hour per month work requirement? So there is actually a bit of flexibility here. They do offer a couple of different ways to meet those work requirements. So you can either be spending 80 hours a month doing, either work or volunteer or etc., or have a monthly income that is equal to 80 hours per month of at least federal minimum wage. And so for seasonal workers, Medicaid does basically take the average income over 6 months. I'm not exactly sure how they would determine like what 6 months they're looking at. It's possible that there might be special paperwork that seasonal workers might need to fill out. I'm not exactly sure about that level of detail, but there are some allowances in the law for work that's not as steady. Um, okay, any questions there? Let me double check, give people a moment. Nesha, I see your question. I love it. I will get through the community questions, but we'll definitely talk about that in a minute. Okay, so next question. What if I need to travel out of state for my specialist and can't meet the work requirement? So the law does actually give states an option to allow a temporary kind of short-term exemption from the work requirement. So if you have to travel for medical care, if you are hospitalized or kind of receiving a similar level of inpatient medical care, if there's a natural disaster or like federally declared emergency in your county, or if your county is experiencing a high rate of unemployment, those are all scenarios in which your state has the option to grant a temporary exemption. However, there are some states that have chosen not to adopt some or all of those exemptions. Specifically, Indiana and Iowa have chosen not to adopt any of them. There's a few other states that have already declared they're only going to adopt, say, like two or three of the four. Some states haven't announced yet which ones they're going to adopt. So again, it's really important that you make sure that you know specifically in your state what rules are going to apply to you. Okay. Um, so the next set of questions here, if Medicaid is our secondary insurance, how does that work with these Medicaid changes? So kind of in general, with these changes, it's not going to matter if you have Medicaid as secondary or primary. The thing that determines if work requirements apply is whether you are eligible for Medicaid only based on income or if you also have a qualifying condition like a disability. That being said, though, if you have Medicaid as a secondary insurance, it is most likely that the other type of insurance you would have is Medicare. And like we saw on an earlier slide, if you are eligible for Medicare, then you would be exempt from the work requirements. So good chance if you have Medicaid as secondary insurance, it might not apply. The work requirements might not apply to you. Okay, and then the next question, how does transitioning from child Medicaid to adult Medicaid work with these new changes? So this one's a little bit of a bear, just because we're talking about transitions and that can be complicated. But generally, folks who transition off of Medicaid insurance as a child, will have to go through the process to apply for adult Medicaid and have kind of that brand new determination of whether they are still eligible for coverage as an adult. So what I recommend is around your 18th birthday, it's a really good idea to start talking with your healthcare team to see if you can get extra refills of medication or any other kind of thing that'll help ease through that transition as you are transitioning off of coverage. So I guess one thing to note in terms of like the example that was included with this question of like if a medication was approved for the person as a child, would it automatically be approved for them as an adult? Um, Probably not automatically. I say that mainly just because basically every medication for PH is considered a specialty drug. So that basically means that you're always going to have to go through prior authorization before insurance would cover it. So automatically, probably not. Is there a good chance that your healthcare team can fight to make sure that you get coverage? Yes. So you just basically, as much as you can, talk with your healthcare team in advance to have a plan of how you're going to navigate that transition from child to adult coverage. Um, but all that being said, I will say there have unfortunately been kind of data that has shown people in that like 19 to 21-year-old range are more likely to have coverage gaps in their insurance. And that's true whether folks are kind of more healthy or folks who have complex health needs. There is an increase at that age range, which is frustrating for folks who have a lot of health concerns that they need to navigate. Um, okay, so those are the, I think, broadest community questions. I did kind of combine a couple of them together, but hopefully folks recognize their questions. I do have a slide here that's just links to more resources. This is where I got a lot of my information from. So if people really like digging into stuff, these are some good areas to start. Um, and then lastly, before we launch into the Q&A, I do want to just give a quick final thank you to our sponsors. Um, let's see. So I will go back so I can make sure I'm looking at our chat and Q&A. Um, okay, so I see Melissa has a question. Could a person working 40 hours at $15 an hour meet it because of pay equal to 80 hours of the lower wage? Um, I think yes. I think that that would be the case. I think if you're working 40 hours a week at $15 an hour, as long as you're meeting that like total amount of income, I believe so. Again, this is a great spot to kind of double check with the Medicaid program staff members. If you're able to reach out to anybody and get clarification, I would highly recommend that because I'm um, doing the best that I can looking at things on like a national level. But there is a lot of nuance that each state is going into as well. I also see from Nesha a question about, is there a task force that I can join in Georgia to stand up against these changes? Um, I think there are some areas where people can still submit like experiences. I would say probably more so than like standing up against the changes. Anything that folks can do to document loss of coverage or loss of services, any example of how these changes are causing harm to people in our community are super, super important for us to collect and know about and bring to Congress to show that these changes are not being implemented very well or we're not given enough time to be implemented well. It is, um, I do just want to take a moment to acknowledge that these changes are really frustratingly challenging, and I think in particular the idea that we're adding work requirements to qualify for Medicaid, but that there is no change to the maximum level of income that can be earned. So people now have to thread an even thinner window to earn enough, or at least spend enough hours. Like, I guess, granted, you can do volunteer work that wouldn't, hit against your income so that you don't go over the Medicaid income, but obviously, as we know, people living in the real world, that requires transportation and other things that aren't free. So it's still, whether it's paid work or not, it's still requiring people to make changes that aren't really necessary. I see Nesha has another question. At the doctor's office, can we submit a letter of medical necessity to affected exempt persons? Would that help? So that might be needed. It is going to depend a lot on whether that particular patient has is covered under Medicaid expansion. So if you have someone who is not has Medicaid through disability, but they are still in that medically frail area, it is possible that they would need their care team to put together something like a letter of medical necessity or, a letter writing up like these are the symptoms that my patient is experiencing on a day-to-day basis, and therefore it's not advisable that they be required to work or something to that effect. So definitely once we have more information about how that medical frailty exemption is going to be defined and enforced, we will have more specific guidance for healthcare providers of what they can do to help their patients and for patients to advocate for themselves as well. But yeah, as of right now, it's possible that those types of letters would be a useful tool. Not sure if they'll be like 100% necessary for everybody. Um, okay, really, really good questions. I love these questions. I guess going back to that idea about kind of standing up against these changes, like I said, collecting stories of any examples of how this is not working out well, that's causing harm to patients, super important. I will dig into some other coalition actions. I believe there are some like task force or at least like areas where people can submit comments. So, like Nesha, I can kind of connect with you one-on-one if there are specific things within Georgia that I can find. But in general, if anybody is really passionate and interested and has the time and wants to submit comments of how these changes are going to be really challenging for a lot of various communities that have complex health needs or disabilities. We can definitely connect on that, and I'd be happy to get you in touch with the right people to at least make sure that those comments are heard and considered. Um, but yeah, unfortunately, we're since the law has passed, we're a little bit in the next phase rather than standing up against the changes. But we are at least hoping that we can get them changed back in the future. I think is kind of where the next phase of advocacy against this type of thing would be headed. So that's why those collecting the stories to show that we should change these work requirements is going to go a long ways in the future, I think. Awesome. Okay, well, that is all the information I have for everyone. So I'll give another few moments for people to ask any questions that they might have. Also, please do feel free to reach out to me. You're more than welcome to call PHA or to email me, and I'm happy to try to give information as best I can. Granted, as I've said as caveats many times, it is super dependent per state. So different states are going to have different circumstances and different requirements and things. But if people have kind of specific questions like that, I can do what I can to get you at least connected with the people who know the answers if I don't know them myself. Alrighty. Well, I don't see any other questions at the moment, but thank you everybody for tuning in. Really appreciate your interest in this topic, and we will stay in touch about any new changes that we learn about. Thanks, everyone. Have a good afternoon.